The cardiac cycle is the period of time that begins with atria contraction and ends with ventricle relaxation. We define periods of contraction in the heart chambers as systole, and periods of relaxation when the chambers will refill with blood is our definition of diastole. Both the atria and the ventricles undergo periods of systole and diastole and are coordinated with one another so that the heart efficiently pumps blood. Systole generates pressure on the blood inside the heart chambers, and that pressure is what drives the flow of blood. Blood will flow from high pressure to low pressure, and diastole creates low pressure in the heart chambers so that blood can refill those chambers. The entire cardiac cycle is approximately 0.8 seconds long, assuming a typical resting heart rate of 75 beats per minute, which is set by sinus rhythm. The atrial filling phase is the time during the cardiac cycle when the atria are in diastole. At this time, blood pressure in the atria is lower than in the veins, such as the superior vena cava, the inferior vena cava, and the right and left pulmonary veins. So blood flows from those veins into the atria. Recall that the superior and inferior vena cava deliver blood to the right atrium, and the right and left pulmonary veins deliver blood to the left atrium. The bicuspid and tricuspid valves between the atria and the ventricles are open, since the ventricles are also in diastole at this time. Blood will passively fill the ventricles at the same time the atria are filling, and this accounts for 80% of ventricle filling. We also see that the pulmonary and aortic semilunar valves are closed, since at this point the ventricles have not yet begun contracting. Those sets of valves will open when the ventricles begin to contract and blood pressure starts to rise in the ventricles. Next, the atria enter systole and contract, increasing the blood pressure of the blood inside of them and pushing blood into the ventricles, and this accounts for the remaining approximately 20% or so of ventricle filling. So at this point, the ventricles are now the fullest they will be before they enter systole and contract. And with this, the ventricles reach what is referred to as end diastolic volume, or preload, which is typically around 120 to 130 milliliters of blood at resting heart rates and resting heart forces of contraction. The ventricles will then enter systole approximately 100 milliseconds, or 1/10 of a second, after the atria contract. This delay gives time for the atria to contract and complete the filling of the ventricles. When they do begin systole, the blood pressure in the ventricles will start to rise as a result, closing the bicuspid and tricuspid valves. And this creates the first heart sound, that is the closing of the valves creates the first heart sound, which is a lub sound. And for a brief moment, with the closing of the bicuspid and tricuspid valves, the ventricles will enter what is called the isovolumetric contraction phase. This is a short time when all four heart valves are closed and blood pressure in the ventricles is rising rapidly. Eventually, the ventricle pressure will exceed the pressure in both the aorta and the pulmonary trunk, and the aortic and pulmonary semilunar valves will be forced open. Blood will be ejected from the ventricles into the aorta and pulmonary trunk at that point, and that marks the ventricular ejection phase of the cardiac cycle. The ventricles will eject approximately 70 milliliters of blood at rest with each beat, which this volume that is ejected is referred to as the stroke volume. And after ventricular ejection, approximately 50 milliliters of blood will remain in the ventricles, which is a volume called end systolic volume. And this is the emptiest that the ventricles will be prior to refilling. After the ventricles eject blood into the arteries, they enter diastole and relax. At this point, blood pressure in the ventricles drops, closing the pulmonary and aortic semilunar valves, which creates a second heart sound, which is a dup sound. The ventricles then enter a phase called the isovolumetric relaxation phase. Again, this is a point when all four heart valves are closed and blood pressure is decreasing in the ventricles, since the ventricles are entering diastole after ejecting their blood. And eventually what we're going to see is that the pressure in the atria will exceed the pressure in the ventricles, which will force open the bicuspid and tricuspid valves. And at that point, we will begin ventricle filling and return to the beginning of the cardiac cycle.